Let's talk about skin tags. Skin tags are benign growths that crop up on the skin, typically the neck, face, eyelids, upper back, and some other areas. Actually, they can occur just about anywhere in the body, and they're kind of unsightly. It makes people a little embarrassed when these are exposed to the public sight. Well, if you go online, you'll see plenty of home remedies as well as surgical remedies or dermatological remedies to get rid of them, to remove them, to burn them, to use various salves or ointments to get rid of them. But I'll tell you in an even better way. Just as we do in all my programs, in the Wheat Belly Total Health, in the Undoctored programs, rather than treat things, let's remove the causes. Let's correct the factors that lead to these kinds of things. So what causes skin tags? You might even be grateful for skin tags because they tell you you have significant resistance to insulin. That is, your body is not responding to its own insulin. So the pancreas responds by producing more insulin. So people with skin tags can have fasting insulin levels rather than a really low desirable range like 0, 1, 2, or 3. They'll have 20, 30, 40. It's a sign that you have insulin resistance and on your way to prediabetes and diabetes and all the other complications of insulin resistance, which are long and a very unpleasant list. Things like cataracts, hypertension, heart disease, dementia, cancer, hormonal distortions. So insulin resistance is a driving process in so many health problems, but a skin tag is your body's way of telling you you have insulin resistance. So rather than resorting to ointments or surgical removal, that does nothing to address the cause, right? Address the insulin resistance. Well, how do you do that? Well, all my programs, Wheat Belly Total Health, Wheat Belly 10-Egg Grain Detox, the Undoctored, all books, as well as my Wheat Belly blog, Undoctored blog, Undoctored Inner Circle, the true deep dive into health and how to manage it on your own, are all these programs reverse insulin resistance, and it does so effectively and rapidly. How do you do that? Well, we remove foods that trigger insulin. The worst, wheat, grains, and sugars. So we banish all those foods. We limit net carb exposure to 15 grams or less per meal. We correct vitamin D deficiency, because that has a major role in determining your insulin responses. We correct the magnesium deficiency that everybody starts with because you drink filtered water and some other reasons. We take omega-3 fatty acids from fish oil because that has beneficial effects such as subduing after-meal or postprandial lipoprotein excursions that develop after meals. We correct thyroid dysfunction, starting with iodine, and then take additional steps to make sure you have optimal thyroid function. And then we take additional steps to cultivate bowel flora. It sounds like a lot. It's really just 6 basic strategies. Put them all together and you have astounding power over your insulin resistance, and you revert back to being insulin sensitive. And if you were to check an insulin level, you see it drop from, say, 35 microunits to 1 or 2, suggesting that your body no longer needs to produce tons of insulin to overcome the resistance to insulin in the muscle and liver and other organs. And that's how you regress skin tags. So think of the skin tag as your body's sign telling you something's wrong, and it can be your body's sign when they resorb and go away that you've achieved sensitivity to insulin and have thereby absolved yourself of all those potential health problems that could have been waiting for you down the road.